Good afternoon, Abby Delray South residents. Jennifer Stevens here with an update town hall for October 8th, 2020. I'd like to take a minute and introduce two of our newest team members today. Taylor Spalding is our nursing home administrator, and Sheldon Calvin is our director of nursing. So they're going to just introduce themselves and talk a little bit about their plans for the health center.
Hi everyone, my name is Taylor Spalding. I'm your new healthcare center administrator. I've had the opportunity to work as an administrator in many locations from Ohio down to Florida on the other coast in St. Petersburg, and now here at Abby Delray South. I'm very happy to be a part of the community here and really looking forward to continued service for you and all of our residents here in the facility. Now I'll introduce Sheldon, our new director of nursing.
Hi, good afternoon. My name is Sheldon. I've been in nursing for over 15 years. My nursing career began with at Harbor's Edge. I'm really happy to be here. My job is to continue to build a strong team to ensure that all of our residents get the best care. Thank you.
We do have some exciting plans for the health center, and we have some areas of focus that we really want you guys to know that are our core areas that we're focused on. The first one is customer service. We're really working to ensure that you have friendly, caring staff anytime you need the services provided by the health center. We also want to make sure that there's quality care provided to you by knowledgeable nursing staff and good doctors that will be able to meet all of your healthcare needs. We want to make sure that you guys understand that a good experience in the health center is our top priority, and that you guys have all of the services and support that's needed to make sure that if you need an additional level of care beyond your residential living, we are here to support you and make sure that you have a positive experience and we get you back home happy, healthy, and safe.
Thanks, guys. Well,
Thank
we're
you.
so happy you're here.
Thank you.
Okay, so I'm going to give you some more updates for this week. So first I want to talk about the COVID update. Currently we have no health center residents positive for COVID. We do, however, have one team member that tested positive for when we did our testing last week. I want you to know, though, it's an excellent outcome considering we test over 100 people every single week. And we have not had any positives in the past 3 weeks. So the team member that's positive, she's home, she has no symptoms, she's doing well, and she's under the care of her doctor. Effective immediately, we are now able to utilize the assisted living and memory care at Abby Delray. Great news. Our residents will have access to these levels of care while keeping their life care contract open with Abby Delray South. This means that you will still have the option to come back to our healthcare center should you need to be transferred to a higher level of care from the assisted living or memory care, should you choose to use either one of those levels of living. Information regarding the details and financials for assisted living or memory care will be coming soon. You now have the peace of mind that we do in fact have the full continuum of care for Abby Delray South residents. Sales department. We have parted ways with our Director of Sales, Suzanne Bauer. We wish her well in her future endeavors. We needed to make a change. I've decided to partner with Abby Delray, who also is in need of a Director of Sales. We will be joining forces in the sales department and are looking to hire a Director of Sales to cover both communities. This will then allow the sales team to cross-sell both communities. We've been operating as competitors for far too long. It's time that we work together as the sister communities that we are and complement to one another. Our goal is to be a one-stop for all prospective residents. As we work together with Abby Delray, we will have the full continuum of care as well as something for everyone between the two campuses. Our marketing efforts will be combined, giving us more robust resources and exposure to the greater community. Our sales team is excited and ready to take on this new opportunity. Please be sure to welcome the sales counselors from Abby Delray if you see them touring a prospect, Norris Petty or Justin Mercer. Next is a culinary update. Christian and I are working on some dining options to begin in November. Our plan is to open the dining room for reservation only during lunch and dinner Monday, Wednesday, and Friday at first. You will be asked to make your reservation in advance, 4 people to a table only. We will ask that you have your temperature checked as you enter the dining room, and masks will be required while walking through the dining room and all common areas. Tables will be spread out so that we maintain social distancing, and we will not seat the dining room to full capacity. No walk-ins will be permitted as well. If we see that we have residents interested in eating in the dining room, we will expand to offer more days. If there is, God forbid, an outbreak of COVID in the community, we will stop the dining option immediately. Complimentary meal delivery will continue even as we open the dining room for anyone that does not choose to dine with us. So it's really your choice. If you'd like to eat in the dining room, you certainly will be able to, but we also will still provide the delivery service. Health Center Clinic update. As of November 5th, we will no longer be working in partnership with Glades Medical as our clinic provider. We will be moving to a new provider, Conviva, now affiliated with Humana, to operate our clinic. We will have a new physician who will be providing services to our residents in partnership with Dr. Joe Auslander. He's the geriatrician and senior advisor to the dean at FAU School of Medicine. Dr. Auslander will be sending out a letter to our residents introducing the new provider and physician services that will be provided. Stay tuned. Safety update. Earlier this week, I sent out a voice message reminding our residents of the process for emergencies. I went through the steps of pulling the emergency cord to get the process started. I neglected to tell you that pushing your emergency pendant is also a great way to initiate the emergency process. So you can either pull your emergency cord or push your pendant to get assistance. Most importantly, do not take your fellow residents to the hospital in an emergency. It is not safe, and you are putting them and yourself in a situation of risk. Use our system that we have in place. It's safer and a much more efficient way of getting the emergency help that's needed. In addition, if you do end up calling 911 on your own or for a fellow resident, pull the cord or push the pendant as well. This way, we can still support the situation by making sure when paramedics arrive, they know exactly where to go, and we will also contact your family or designee to let them know you were taken to the hospital. So please keep us in the loop as much as possible. Finally, Team Member Holiday Fund. This year has been particularly difficult for our team members, as you can imagine. The department directors and sales team have decided to opt out of the holiday bonus this year. Our goal is to keep the funds that are collected going directly to the team members on the front lines. I have to say I'm incredibly proud of my team and this wonderful selfless gesture. This is a display of their character and who they really are as individuals. We all understand how important our team members are and how we could not operate this community without them. We want this to be a wonderful holiday season for them and their families. I want to thank Roberta Hyman and her committee in advance, as I know they are working so hard to make this project successful for our team. Please donate to the Team Member Holiday Fund. This is a time to show your appreciation for all that they do for you. This concludes my update. Please have a safe and pleasant evening. Thank you.